in the most recent past, we had a major outbreak of Ebola in Uganda, which started in the middle of the country, and we were able to respond and bring the epidemic to an end without it spreading to any other of our neighboring countries. The key success to this outbreak management was good leadership, good coordination, and partner support with all the experience that was brought on board by all the respondents. The people of Uganda were able to trust and listen to the leadership right from the president to the minister when they called upon them to respect the guidelines and SOPs instituted at the peak of the outbreak. Whereas the government took a few weeks or days before they could tell that there was something happening in the community, the good laboratory support that we got to confirm the disease helped us to quickly know what we're dealing with in the country. We're able to galvanize support immediately from all government and partners, and we're able to rally the community to respect the regulations and restrictions. The health system was able to use non-medical interventions to respond, including restricting movement, isolating people, putting all contacts on a good contact tracing list so that we could be able to account for everybody who had been in contact with the sick people. In a way, we're able to manage the epidemic without much disruption of livelihoods of the whole country. During this major outbreak, WHO worked as the main technical advisor to the government of Uganda. We were able to work with all the technical teams to fill up parallel support mechanism within our pillars of response in the ministry. Whereas we acted through different pillars, leadership, coordination, surveillance, we had technical support from WHO from all those different pillars. In the last 10 to 20 years, government abolished user fees and provided universal free medical care for all the citizens so that people, children, and vulnerable population can access free care without paying user fees and reduction of out-of-pocket expenditures. It has also grossly expanded the infrastructure to give community interventions an opportunity to prevent diseases. In so doing, we have seen that the number of children and women dying during child delivery, HIV prevalence have all gone down, and life expectancy has moved from 43 years 20 years ago to now the 63 life expectancy for all Ugandans, which is a remarkable achievement of the government.